Not all stem cell therapies are the same, and back today to explain what that means is Dr. Lanzaseri from Total Regenerative Therapy. Good morning.
Good morning,
to see you
Carly.
again, Doctor.
Good morning, everyone.
I know. So let's talk about this. And I do think we're seeing more of this, right? Hearing more about stem cell therapy. But I love that we're diving into, listen, not everybody's the same. Not everybody's treating everybody the same. Talk about what you really want people to know this morning.
Well, there are two main types of stem cell therapy. There's the type where you use your own, and you have to go through surgery to get those out of your body. Then they're cleaned up and put back in. And then there's what's called umbilical cord blood stem cells, which is what we use, where we use the umbilical cord blood cells from a healthy born baby who was born 1 to 2 months ago.
Okay.
The reason and the feeling is the younger cells are more robust, have more vitality, and work better.
Let's talk about the results. You were, right before we got started, you were telling me about one man in particular, which is pretty incredible. I was asking you, does anything surprise you anymore? I mean, this has got to be exciting. Tell me about this this man that you were helping right now.
Yeah, so he's a 45-year-old man from Philadelphia. He's in a wheelchair with MS. He has no movement in his left lower extremity. He has a little bit in his left arm. His movement is okay on the right side of his body. But 3 days after his stem cell therapy, he was able to start wiggling his toes in the left foot. And then 11 days later, he could contract his calf and bend his foot up and down. And 3 weeks after, he was able to straighten his leg out, extend it, bend it, and extend it. So he's now back in physical therapy because he has, some confidence.
And his goal is to get into a wheelchair, correct? To be able to kind of...
His goal is to be able to stand so he can transfer from his wheelchair to a seat. So that's what they're working on now. And
what I appreciate about what you do and what we make sure and let people know, this isn't going to be the outcome for everybody. We realize this is not...
That's correct.
A cure-all, end-all for people. I mean, where do you see people really being able to use the benefits of stem cells?
Well, with an MS case, obviously, I tell patients, worst case scenario, it will not make you worse, but you will not get a result. Best case scenario, you may achieve your goals. We can predict more with joint disorders like osteoarthritis of the knee, shoulder, or hip, the type of result we're going to get. But with cases like MS, it's obviously difficult to predict.
Do you tend to see results pretty quickly?
We are seeing...
What is the average length?
For example, the man with MS, within 3 days of his stem cell therapy, he could start wiggling his toes. Our 90-year-old lady, we performed stem cell therapy on both of her knees a month ago, 5 weeks ago. Within 3 days, the pain in her knees was gone. Another 85-year-old man, within 1 week of his knee stem cell therapy, he was able to start walking around the house with no pain and not have to use his cane.
And the last time you were here, we were talking about that as age. Like, are you too old for this? Is your body too far gone? What say you, doctor?
People are not too old. And in fact, I'm looking at the cases we've had this year. We're seeing actually faster results in some of the more elderly people in their 80s and 90s. I have no clue why that is. I do not know. It's just something I'm observing.
Yeah. Well, you have 2 locations. I want to make sure we get to where people can find you. Tell us about one of them is rather new.
Right. So we have an office in Celebration, Florida, on Celebration Boulevard. You'll see the building there. There it is. And we also have our main office on Davis Islands next to Tampa General Hospital.
So when people come to your office, maybe for that first consultation, what can they expect? I mean, how can you find out if you're, I mean, these results are just so exciting to hear, and I'm sure people are very eager to say, I want that to be me.
Right. So we're going to sit down and consult with them and then go over the treatment recommendations and what they can expect.
Okay.
Right.
Well, doctor, thank you so much. We appreciate your time this morning. We're going to make sure and put all that info on our website as well, so it's easy for people to find you. I know there's a special offer as well, which is?
Right. They can come in for a free consultation for being viewers of
The Morning Blend. We love that. Thank you so much,
Go to betterstemcells.com.
Easy enough. Thank you, doctor.